Good evening, everyone. I am Dr. Tariq Jan, family physician from Dhaman Center. Today, I will talk about how to protect ourselves from COVID-19. As you remember that in my previous session, which was held around 10 days back, we talked about COVID-19 in detail. We talked about what is COVID-19, how it spreads, what are the symptoms of COVID-19, and we talk about how can we prevent the spread of COVID-19. If you like to know more about all this in our previous session, you can find it on Dhaman Live YouTube channel, all the discussion which we discussed before 10 days. So before going further for today, let us summarize me about COVID-19. Okay, so COVID-19 was found first in Wuhan, China in December 2009, and it is a new virus. I'm summarizing it, not giving the details because details we have already discussed in the previous session. So it originated from the city of Wuhan in December 2019, and it was named as novel coronavirus, as a novel means new coronavirus, and it started spreading from China. It was thought to be from an animal origin, and then transmitted the person, and then from that time it is transmitting from human to human. So it started spreading from China to the other countries of the world, and the WHO declared it as pandemic. Pandemic means when the virus spreads all over the world. As for now, as we know that there are around 2.5 million confirmed cases all around the world, and more than 250,000 people have died so far. It is spreading very fast. So we must do our best, whatever is possible, to stop the spread of this virus. So, well, let us talk about today's session. How can we protect ourselves from the spread of this virus, and how can we protect ourselves from getting this virus? So at the end of this talk, there will be a question answer session where you can ask me questions, and inshallah, I will try my best to answer your questions. Well, as we know that there is currently no vaccine or specific treatment for COVID-19 as for now. All over the world, the doctors and researchers, scientists are working to look for the vaccine, and it is in progress. And still till now, we don't have anything. So what we have, what measures are right now, except vaccine, except the specific treatment, we have only few measures like social distancing, keeping ourselves away from others who are sick, frequent hand washing, wearing masks, wearing gloves when we are out, when we are going for groceries and all that. So these measures, we will talk about these measures today, how to properly hand wash, how to properly use the mask, how to properly use the gloves and remove the gloves. Because nowadays, as we see that when we go for any purchase in the grocery stores and all that, we have to use the gloves, we have to use the masks, we have to use hand sanitizers, and we have to wash our hands frequently. So as we know from the previous session that the spread of this virus is mainly by air droplet. So once a person who is infected from COVID-19, once he coughs, sneezes, or breathes out, exhales the air comes out with the small droplets, liquid-like droplets. When a person sneezes or coughs who is sick, the droplets come out of his mouth from his lungs, and they spread around, and they sit on the surfaces like tables, chairs, trolleys, handles, knobs, switches, anything what is around, even on any surfaces. After some time, because these liquid particles are little bit they weigh more than the air, so they settle down on the surfaces. But few of them stay in the air for some time. So these particles can stay on the surfaces for from few hours to few days, depending upon the surface and moisture and other things where the virus survives. So now we know that the main source of this virus, getting a virus from a sick person who is sick, is from his air droplets, and which are settled around you. So the best way, the first thing, is to maintain the social distancing. As we know, if a person sneezes or coughs, the air droplets can travel up to 1 meter, up to 2 meters, and even more, maybe some small particles, even more. But most of the particles, these air droplets, they can, when we cough, they can go up to the distance of 2 meters. So we should always maintain at least 6 feet from the other person. If we are standing in a queue, if we are going for some purpose, if we are going outside, if we are going for some by purchasing any groceries or any items, at least we should maintain a distance of 2 meters, 6 feet. That's approximately 2 meters from other person. And why it is mandatory, why it is important, because in my previous session, and now I will also say that there are some people who are asymptomatic. That means they don't have any symptoms, even coughing, sneezing, but they are COVID positive. Even a person has no symptoms. He has no fever, he has no cough, he has no shortness of breath, he has no body pains, he has no signs and symptoms of the diseases, but he can be positive. The virus can be inside his lungs, and he can be asymptomatic totally. So once you come in contact with this person, obviously through the air while he exhales and you inhale the same air, or when he exhales his air, it settles down on the surfaces. So you can unintentionally, we touch the surfaces with our hands. So hands are the main source where from we get the virus. Okay, mostly in the air we cannot get it. It's not airborne. It is the air droplet infection. So the most important thing, our hands, because when we touch any surface which is contaminated, we sometimes touch our nose, touch our mouth, and touch our eyes. So the virus entry, portal of entry of the virus inside our lungs, inside our organism, is through eyes, nose, and mouth. Because the virus, this COVID-19 coronavirus, needs a medium to enter in our body. It cannot enter through the skin, it cannot enter through the ears, it cannot enter through other sources except through the eyes, where there is a mucus. It can enter through the nose and through the mouth inside our body. So this is the portal of entry, and hands are the main source. So for that thing, so that we can protect ourselves, one, I said the social distancing. Second thing is hand washing. Third thing is wearing the masks. And fourth, like wearing the gloves whenever necessary, not always. Okay, well, so going to the hand washing. So the best thing is to wash your hands with soap and water. The best thing. But if soap and water is not readily available, we can use a hand sanitizer which contains at least 60% of alcohol. Hand sanitizers, you can just check, it is labeled as minimum 60% of the alcohol should be in the hand sanitizer. So it is an alternative. It is not the number one choice. Number one choice is soap and water for at least 20 seconds. So how to wash? Because mostly we people, as common people, what we do, we go and just take the soap and just rub around the water and do like this and go. Right? Everyone, our kids, common people, and many people, what they do, I have observed, and we observe in our lives that people do like that. Just go in front of the tap, put some water, soap, that's this, and just put the water and go back. But we should not forget that we should desanitize our hands properly. We should sanitize our hands properly. We should put the soap all over our hands. We should wash thoroughly. So there are some steps, please. If possible, who is watching now, let us do it together. Let us practice for it. It is a very easy. You will remember it. Let us do it together. So I'm putting some hand sanitizer on my hands. Okay, small quantity, as I cannot do it with the soap and water. It's same with the soap and water. Put some quantity, either it is a liquid soap or a normal soap. Just put in your hands and rub it. Number one is this. Okay, rub it from the back side. Okay, then we have inside the fingers, these portions, we have to make sure we are rubbing inside the fingers. Number two step, from the back side of the fingers, so that back side of the fingers, and then we have to rub our fingers from their nail beds. For that, we have to hold like this and do the motions. 1, 2, 3. It is 20 seconds. It will finish. I'm doing it slowly. You can do it faster. Okay, like this. Then what is left? Thumb. So from thumb inside to outside, not from outside to inside, from inside to outside, so that we don't contaminate again this hand. So from inside to outside, right hand and left hand. Then nail beds, nails, we can do it. And at the end, our wrists from upside down. Now our hands are clean. It is very important because what I said that in the beginning, that our hands are the most important source, the main source where we can get infected. Although you know that from air droplets, but the surfaces we touch every day, our doors, our car keys, our wallet, our lift knobs, our handles, door handles. When we go for a shop, grocery shop, unintentionally we touch the baskets, we touch everything. So hands are the main source where we can get infected. So be sure to clean your hands. I again and again say that we should wash our hands as frequently as possible when we go outside. Once again, I will demonstrate. Please, if your kids are around, I would appreciate if you bring them near the screen so that they also demonstrate it. They will enjoy it. Just let us do it again. Number one, I put a quantity of hand sanitizer or whatever soap. I do it one from the back side, then in between the fingers here, okay, and then reverse. Very good. I hope you are enjoying it. You are doing it. Do it with me. It is very easy. And then the nail beds, okay, nail beds from right to left. And then our thumb is left here. So from inside to outside, again inside to outside, and then at the end, our wrist. So we can do our wrist like that. So our hands are clean. What is next now? Our hands are clean. Next is how to wear the gloves. If we are going outside to buy some grocery or touching the handles or touching the trolleys, we have to wear the gloves, right? Because we know that we don't know these surfaces are clean or not. So we use usually gloves, disposable gloves. There are different types of gloves, but it is same as you use it. Disposable gloves, there are surgical gloves, and there are normal gloves like plastic gloves, okay, thin plastic gloves, which are given in our grocery shops nowadays. When we go for a grocery, they are providing us like in Lulu and all that. So the technique is same for all the gloves. Just take the gloves and put it on one of your hands. There are three sizes of gloves. If you have surgical gloves, there are three: small, medium, and large size according to our hand size. So this is the large size. So I will put, while putting it, you can just put it in your hands, okay? Okay, once your gloves, okay, you will put on the both hands, because your hands are clean. So you have not to think about that I'm contaminating or anything, because your hands are now clean. So you can wear your gloves, wear it and cover your gloves. If you have clothes, cover it till end, okay? Cover it till end. There is some moisture in my hands. That's why these are sticking little bit, okay? They have no powder, okay? Now I have wear the gloves, okay? When I go outside, okay, I have a mask also. Okay, I will later on demonstrate how to use a mask. Now these gloves, okay, I am using them gloves. I am touching my trolley. I am picking things. I am touching all the surfaces. So obviously, these gloves is all over. There will be viruses and bacteria, not COVID-19, other viruses, bacteria, and we don't know, maybe COVID also, because as I said that some people have diseases and they don't have any symptoms, and we don't know who has touched these things outside when we go outside. So for that purpose, when your hands touch anything, any around, so these gloves are contaminated from all over, from inside, from outside, from everywhere. So how to remove? When you are done with your gloves, when you are done from the shopping and all that, you have to remove your gloves, right? So how to remove them? So if you will do like, you will put your hands behind here. I am showing it is wrong. If you put your hands behind, you will push the bacteria and virus inside your hand, and they can contaminate your wrist and hands. So for that purpose, we should just pinch the gloves from outer surface. Don't touch the inside surface with your contaminated hands. Okay, just pinch the end of the gloves here. I am showing you. Just pull it. See, I'm not touching any of my hands or anything because everything is dirty outside. So I just pinch it and just pull it, and it is, you see, it is going upside down, and I will keep it inside my hand without touching anything. Now my finger will go behind here because this surface is clean, inside surface. I hope you are seeing it. So here I am putting my finger down and just moving it upside down, and removing it. So it is now upside down. The surface which was contaminated, it is inside, and it has become, because I turned it upside down first, right, and then left. So the upside down, and then disposing it nicely into the dustbin. So please don't dispose your used gloves anywhere in the surroundings, because you are harming your society, you are harming your friends, your family, you are putting everybody at risk. Once you use the gloves, please put in a proper dustbin and dispose it properly in the dustbin. So this is how to wear and remove the gloves. Now coming to the mask. You can watch this video again later on if you would like to, demonstrate, if you would like to learn more how to wear and how to remove the gloves. Coming to the mask, we have different types of masks. This is the simple surgical mask. We call it a surgical mask, simple surgical mask. Okay. We have another mask which is known as N95, which is a cone type mask, which is used for usually healthcare professionals in the hospitals, where the doctors or healthcare professionals are in close contact with the patients, with COVID-19 patients, where they have to go close to them, examine them, use procedures on them. For that purpose, that N95 mask is used only in the hospital setup. So if you have the surgical masks, okay, this is the surgical mask. If you have this, you can use this. This is also good mask. You can use it. And even for going outside and any other place where it is crowded, where it is, you can use this mask. But if you don't have the surgical mask, you can use a cloth mask. As per CDC now, they have advised to use a fabric mask, fabric cloth mask with multiple layers, which you can just purchase from outside ready-made, or you can prepare at home. So this mask actually has two sides. One is the blue side, one is the white side. Okay, once you take the mask from the box, make sure you are not you are washing your hands. You are washing your hands with soap and water or with a sanitizer before touching the mask. Okay, once you take them, and before wearing the gloves, you have to wear the mask. Once again, I will repeat, please don't after washing the hands, put your mask first, then wear the gloves. So once you take the mask, there are some masks have green color and white color, some have blue and white, both are same. Oh, this color should be, the colored side should be on the outside, outer side, and white side should be on the inner side. So just gently pull the mask from the box and put it on your face with these strings behind your ears, and pull the mask down your chin. And here is a metal strip inside, which is very light, and you have to just press from both sides so that the place here, it is totally closed by the mask, so that there is no source of air which can enter from up or from the sides. And you have to make sure that you pull the mask below your chin so that it covers the whole face. As you can see, I'm showing you my side. Everything is closed, but if you keep it here, there is a space here where bacteria or virus can enter. So make sure you are covering it totally from all sides. Okay. So what happens once we breathe in and out? Of course, the outer surface, it appears as a filter for all the bacteria and viruses, right? So the outer surface becomes contaminated, becomes dirty, we can say. All the viruses, bacteria stuck on the outer surface and on the filter of this mask. Even if it is a cloth mask, fabric mask, the outer surface becomes contaminated because it acts as a filter. You think that it is a filter, okay? So what happens when we are wearing gloves or without gloves? Some people, what they do, they use the things and then start touching the mask again and again. They do it again and again. And even some people, what they do, they pull the mask down, keep it like that, and start talking on phone. And after some time, they will again pull the mask and put on the face. So what will happen? Of course, when you touch again and again, all the hands are contaminated. Outer surface of the mask is contaminated. Everything, when you touch the mask down, when you talk, of course your hands get contaminated. Again, you are touching, your face, your mouth, everything from the edge of the mask. You are putting yourself at more risk. Even some people do like that and start talking or whatever. They drink the tea or they just drive, and then when they want to go to some grocery shop, then they will just pull it like this or even like this. But it is wrong. Please don't do this. Once you wear the mask, just wear it properly in this way. Close it from this side properly. And once you want to remove the mask, you wear it and wear it. Don't move it up or down. Okay. Once you want to remove it, if it is a washable mask, if it is a fabric mask, you can make the mask from a fabric cloth with 3 layers, okay, from any cotton cloth. But make sure that you can breathe nicely through the cloth. It should not be a silk cloth or anything which can make difficulty in breathing. Okay. So once you want to remove the mask, so you just go behind the ear, okay, from right, from left, and just dispose the mask in the dustbin. Don't touch the mask from outside because it is all contaminated. Once I remove this mask, it is all contaminated from outside. It is a filter. There are a lot of bacteria. We don't know what type of bacteria, what type of viruses have settled on this outer surface. So what we have to do, we have to just take the mask carefully. I will show it again, demonstrate it again. Remove the mask from back side and just throw it into the dustbin. Okay, nearby. Please don't throw the masks on the roads. I have seen many times that people are throwing the masks, throwing the gloves on the roadside, inside the buildings, inside the lifts, which is very wrong. We are putting our families, we are putting our friends, our families, our nation, our citizens, our residents at risk. Please do not that. Please, for God's sake, please do not do that. Put the mask in a proper dustbin. And after putting the mask in the dustbin, we should again come to the hand washing. Because once you remove the mask, maybe you have touched some part of the mask. And it is always when you wear the mask, before we have to make the hand wash or hand rub. And after removing the mask, we have to make again hand wash and hand rub. Also, while wearing the gloves, before wearing the gloves, we have to make the hand wash or hand rub. And after removing the gloves, if you have the hand sanitizer in your car or anywhere, just after removing the gloves, you are removing it nicely. You are not touching anything, but still we have to wash our hands after removing the gloves. So these were the basic steps, basic things. How can we protect ourselves from this COVID-19? As I said, that hand washing, wearing the mask when we are going anywhere, keep yourself at least at a distance of 2 meters from others when you go for grocery shopping, when you go for any place where there are more than 4 people around, wherever you will go. Keep yourself at distance from others. Other thing is the gloves, the wearing and removing the gloves. I also demonstrated it, and I hope now you will be able to sanitize your hands properly, wash your hands properly. The best thing to wash your hands is by soap and water. So if you don't have soap and water around, if you are outside, you can use the hand sanitizer, which contains at least 60% of alcohol. So if you have any questions after listening my talk, and I demonstrated you about the masks, gloves, and hand sanitizer. If you have any questions, please you can post your questions here, and I will try my best to answer your questions. As CDC says now that we can use even these fabric masks. You can make your masks from a fabric with 2-3 layers, okay, and it will protect. It will protect. If anybody is sick, it will at least protect others from getting infected. So if you are sick or you are not feeling well, any one of us, if he has some sort of sneezing and cough, please, in my previous session also, we can use our flexed elbow while sneezing or coughing. If you are not wearing the mask, use your, if you don't have the mask and you feel some coughing or sneezing, just put your flexed elbow in front of your nose and sneeze. And better try to avoid crowded places. Keep a distance of at least 2 meters from others when you go for grocery, when you go for shopping. These are the measures where we can prevent the spread of COVID-19, sorry, because it is spreading very fast and the cases are increasing day by day. And the only thing we can do is to prevent the spread of the virus by thoroughly hand washing, doing the proper social distancing, staying at home. These are the main things which can prevent the spread of these diseases. So if anybody having any questions, please post your questions. I will be glad to answer your questions. And in case you have any questions, if anybody will not be able to put the questions now, you can ask your questions in the comments or on our social media account, Instagram and Facebook, Dhaman Health. You can find us, Dhaman Health, on Instagram and Facebook. If you have any questions, you can ask us there, and we will be glad to answer any questions, any queries or doubts. It will be our pleasure to remove those doubts. Well, Mr. Adnan is asking, can we use fabric mask instead of a surgical mask? Yes, as I said before, that Mr. Adnan, yeah, actually, we know that it is not possible to purchase a big quantity of masks from the medical stores, and there is a shortage, and we should always give a priority for medical professionals to use these surgical and N95 masks. So if you are not sick or you are going outside in places where it is crowded, or any grocery shops or anywhere, you can use a mask which is like, a mask made of fabric, 3 layers, 2 or 3 layers, cotton fabric. You can make it at home. You can see on YouTube, there are a lot of things where you can a lot of videos where you can see how to prepare a mask at home. You can wear that mask and wash it, or you can wash it also in your washing machine with a normal detergent and use it again. But these surgical masks, these are disposable masks because there is a filter inside. It is not a washable mask. It is not a reusable mask. It is a disposable mask. I'm talking about the fabric masks, which can be reused by a common people, not by health professionals, by the common people. Okay. Mr. Said Rahman. Okay, great. Gayal Sheikh. Thank you, Gayal Sheikh. Yes, it is always our priority to explain the things, how can we protect ourselves, our families, our friends. So it was my pleasure today on behalf of Dhaman Healthcare to be here on live session for conveying the message about hand wash, about using of masks and gloves. I appreciate your time spending on watching this video, and I hope you will convey the message further to your families, to your friends, to your nears and dears, because the most important thing to stop the spread is by washing the hands, because the main source is hands. Hands are the main source, as I said again and again. So I will again say at the end, I would like to again say that is it necessary to wash? And there is a question from Mr. Adnan. He is asking, is it necessary to wash hands for exactly 20 seconds? Actually, yeah, I said in my talk before that we should wash our hands for 20 seconds or use the sanitizer for 20 seconds. It has been, there has been a lot of research is done that how much time is sufficient to remove the most of the germs and most of the bacteria from our hands, so that our hands become clean from most of the bacteria and germs or viruses which are on our hands. So studies have shown that 20 seconds are sufficient to use it, but we cannot do it in 5 seconds. As in the beginning, I said that if we wash it within 2 or 3 seconds, we will leave most of our hands contaminated in between the fingers, in between the nail beds, inside nail surfaces, thumbs, and all that. So it takes at least, as the steps I showed you, it takes at least 20 seconds. 20 seconds to wash our hands, even 30 seconds. When your hands are contaminated with a visible, with any visible thing, when you can see some dirt or anything, or any fluid, or any kind of fluid or whatever, then at that time you cannot use only the hand sanitizer. Remember, if it is visible that your hands are contaminated with something which is visible on your hands, you have to make a hand wash for at least 20 to 30 seconds with soap and water. Yeah, exactly. 20 seconds is enough. Why 20 seconds? Because it has been proved that 20 seconds is enough to wash all the surfaces of our hands. If we can see that 6 steps are there. One step, as I showed you, one step. Then second step is in between the fingers. Again, I am demonstrating. So it takes at least, if you count, it takes at least 20 seconds. Then step forward, backward, and again for the thumb, inside, outside. So we don't have to count the time. It is not like, we will count always the time, but approximately keep in your mind that it is 20 seconds so that your hands are clean. Okay, there are no more questions now. As I said, that if anybody having any questions or any queries, and cloth face mask. There is one question from Mr. Gayaz Sheikh. He is asking, Dr. Tariq, for safety and cloth face mask is good to use or no? Well, a good question. Yeah, actually, as I said, that these surgical masks, these are used usually by the health professionals and those people who are in close contact with the patients, who are in contact with, who are working in the hospitals and other. And N95 masks, which are used by the healthcare professionals who are in close contact with the confirmed cases of COVID-19. They work in close contact with them. They do procedures on them. So as a common man, if we are a common people, so for us to protect, if, for example, as I said in the beginning, a person, he can be COVID positive, but he doesn't know because he is asymptomatic. Maybe he's infected like 10 days before, as the incubation period is 2 to 14 days. Maybe he's infected before 5 days or 7 days or even 10 days, and he is COVID positive, but he doesn't show any symptoms. There are a lot of patients who are COVID positive, but they don't show any symptoms at all. So if we use a cloth mask, at least 2-3 layers of cloth mask made of a cloth fabric, okay, once we put it, at least once a person who is COVID positive, he's talking, at least it will stop. Once he talks, the aerosols, the air particles which are coming, these fluid particles, okay, once they come out from his mouth, they are stopped by this mask. So the person who is like away from him 1 meter, social distancing is important, but at least he is putting all this fluid which is coming from his air bubbles, air particles, these fluid particles which come out from his mouth by exhaling. or talking or sneezing, they are settled on the inside of the mask. So there is less chance that this person will spread the infection to others. And if I am sick or anyone is sick, he is advised to use the mask so that he doesn't spread the virus to the others, so that the virus doesn't settle on the surfaces, so that this doesn't come into the air and settle on the surface. It is not an airborne infection. Again, I will say that it is a air droplet infection. Through the small fluid particles, the virus comes out and settles on the surfaces. Yes, cloth masks, it has been proved by, and it is advised by CDC, okay, that we use the cloth masks. Everyone, if going outside, he or she should use the cloth masks if they don't have the surgical masks. So there is a benefit of using the mask. So at the end, thank you for watching today. At the end, I will conclude with that if you have any other questions, please, you can comment, and or you can write in the comments, or you can go onto the Dhaman Health Facebook and Instagram, where you can ask your questions, and I will try my best to answer your questions anytime. Thanks for watching. It was my pleasure to be with you, and thanks once again. Bye bye.